friends, Pradeep Pendyala, your buddy. Today I am going to talk about history of anesthesia. Friends, this would be very interesting and very informative, especially for all the anesthesiologists of the world. They must know what I am going to speak right now. Whenever you talk about general anesthesia history, the first thing which comes to your mind is the picture which shows a demonstration of general anesthesia by William T.G. Morton on October 16th, way back in 1846, in the Ether Dome at Massachusetts General Hospital, Boston. Surgeons were John Collins Warren and Henry Jacob Bigelow. And this is the thing which comes to your mind. But let me add something more about anesthesia history. And every anesthesiologist of the world must know what I am going to talk about. The Renaissance saw significant advances in anatomy and surgical technique. However, despite all this progress, surgery remained a treatment of last resort, largely because of the associated pain. Obviously, many patients with surgical disorders chose certain death rather than undergoing surgery. Although there has been a great deal of debate as to who deserves the most credit for the discovery of the general anesthesia, it is generally agreed that certain scientific discoveries in the late 18th and early 19th centuries were critical to the eventual introduction and development of modern anesthetic techniques. Two major advances occurred in the late 19th century, which together allowed the transition to the modern surgery. An application of the germ theory of disease led rapidly to the development and application of antiseptic techniques in surgery. Antisepsis, which soon gave way to asepsis, reduced the overall morbidity and mortality of surgery to a far more acceptable rate than in previous eras. Concurrent with these developments were the significant advances in pharmacology and physiology, which led to the development of general anesthesia and the control of pain. In the 20th century, the safety and efficacy of general anesthesia was improved by the routine use of tracheal intubation and other advanced airway management techniques. Significant advances in monitoring and new anesthetic agents with improved pharmacokinetic and pharmacodynamic characteristics also contributed to this trend. Standardized training programs for anesthesiologists and nurse anesthetists emerged during this period. The increased application of economic and business administration principles to healthcare in the late 20th and early 21st centuries led to the introduction of management of practices such as transfer pricing. Transfer pricing is nothing but taxes and payments to improve the efficiency of the anesthetist. The word anesthesia was coined by Oliver Wendell Holmes in 1846 from the Greek "an", which means without, and aesthesis, which means sensation. The first attempts at general anesthesia were probably herbal remedies administered in prehistory. Alcohol is the oldest known sedative. It was used in ancient Mesopotamia thousands of years ago. This sedative alcohol was the oldest known sedative and was used in ancient Mesopotamia thousands of years ago. The Sumerians are known to have cultivated and harvested the opium poppy. In lower Mesopotamia, as early as 3400 before Christ, though this has been disputed. The most ancient testimony concerning the opium poppy found to date was inscribed in cuneiform script on a small white clay tablet at the end of the 3rd millennium before Christ. This tablet was discovered in 1954 during excavations at Nippur and is currently kept at the University of Pennsylvania Museum of Archaeology and Anthropology. Deciphered by Samuel Noah Kramer and Martin Leib, it is considered to be the most ancient pharmacopoeia in existence. Some Sumerian tablets of this era have an ideogram inscribed upon them. Hul Gil. This translates to plant of joy, believed by some authors to refer to opium. The term Gil is still used for opium in certain parts of the world. The Sumerians' goddess Nidaba is often depicted with poppies growing out of her shoulders. I'm sure you must have seen the pictures at various places. About 2225 BC before Christ, the Sumerian territory became a part of Babylonian Empire. Knowledge and use of opium poppy and its euphoric effects thus passed to the Babylonians, who expanded their empire eastwards to Persia and westward to Egypt, thereby extending its range to these civilizations. British archaeologists and cuneiformists Reginald Campbell Thompson writes that opium was known to the Assyrians in 7th century before Christ. The term Arat Papa occurs in the Assyrian Herbal, a collection of inscribed Assyrian tablets dated to 650 before Christ. According to Thompson, this term is the Assyrian name for the juice of the poppy, and it may be etymological origin of the Latin papaver. The ancient Egyptians had some surgical instruments as well as crude analgesics and sedatives, including possibly an extract prepared from the mandrake fruit. The use of preparation similar to opium in surgery is recorded in Ebers Papyrus, an Egyptian medical papyrus written in the 18th dynasty. However, it is questionable whether opium itself was known in ancient Egypt. The Greek gods Hypnos, which means sleep, Nyx, which means night, and Thanatos means death, were often depicted holding poppies. Prior to the introduction of opium to ancient India and China, these civilizations pioneered the use of cannabis incense and aconitum way back in 400 before Christ. The Shruta Samhita, a text from the Indian subcontinent on Ayurvedic medicine and surgery, advocates the use of wine and incense of cannabis for anesthesia. By the 8th century AD, Arab traders had brought opium to India and China. Hope this was very informative and interesting. Wish you all a very happy World Anesthesia Day. on 16th of October. Thank you for patient listening. This is Colonel Pradeep Pendyala, Professor of Anesthesiology at Asram Medical College, Eluru City of Andhra Pradesh, India. Until next time, take care. Bye-bye.